Hi Danny.
I'm here with Katerina, aka Kitty, and Kitty has been working at the clinic now since September 20.
Yeah, that's right.
Just after the first lockdown.
I know.
And I'm so pleased that you're part of the team.
Oh, I'm so pleased to be part of the team. It's a great team.
Lovely. So Kitty, give us a little bit, so just for the sake of introducing who you are, where you come from, give us a little bit of information, because when you first came here you were doing your first year of your advanced clinical massage degree level qualification, but you're now in your last year in the middle of your dissertation, so yeah, I imagine you're kind of quite looking forward to getting that done and over with as well.
Yeah, final year is quite exciting.
Yeah,
We've got
exactly.
a research project that we have to do, and my research project is specialising in spinal cord injuries and looking at hand function.
Which leads me on to my next question, really. So obviously you've chosen that because of your background.
Yeah, so I've been in the healthcare industry. I'm a trained healthcare worker, trained senior care worker. Working with complex needs and like complex medical conditions for about 10 years now. And then in 2018 I had a group of clients that were very persuasive into convincing me to take up a massage qualification.
So did you used to massage them in the care home?
I would massage creams in them. We always used to have a nice bit of time, massage the body creams in, and when I went to look to see if there was any complementary therapies for people in hospitals or in care homes, there was a gap in the system, and so that's what took me to train in the healthcare with the backing of these clients that used to.
So I believe you have one particular client who...
Yes, who was a teacher, a wonderful client of mine, and she used to be a teacher. She used to be a secondary school teacher, and she taught English, so was always correcting my grammar. And her communication was very limited. And as I was studying for the course, she used to grab a body part of mine, and because her communication wasn't very good, she wouldn't be able to tell me what it was, and would laugh incredibly hard, and it would take me ages to figure out. And she used to try and teach me what the muscles were and wouldn't let go of my body until I would tell her what the muscles were. So I feel very blessed that I've had some really great clients along the way that have really guided me in it, and it is those clients that's got me into massage in the first place, which was my only intent was to massage the clients that I worked for in the care home.
And did your qualification.
Did my qualification, yes.
And obviously then came here. So in terms of the mix of the clients we have here, we get a mix from people who come in just need a de-stress, mental health, well-being, but a majority of what we see is clinical massage, people with issues and needing a bit more, which is kind of what we provide. But you have a bit particular speciality in that with the neurological conditions and systemic conditions. So give us a bit of an example about the sort of clients that you see and any success stories that you can share.
Yeah, great. So I see a lot of people with stroke, Parkinson's, MS, so a lot of conditions that have a standard care pathway where there's only so much that's going to be it's more about managing the symptoms. So we see a lot of people with that, and we do a lot of rehab with them. Massage is really helpful for it as well. We get a lot of fibromyalgia come in. That's quite a recent thing where people are being diagnosed with this chronic pain condition, absolutely debilitating pain. And we have clients where we manage that pain and we manage those flare-ups through regular treatment. So that's really, really great that we can provide that service for people.
So just for the benefit of anyone watching this, how does massage manage that for those people? If you were going to say that this is what you've seen, this is how it would work. I mean, obviously every case is individual, but would there be something you could say as a general why massage is good for these conditions?
Yeah, it's a good question. So we know that touch therapy is a really important therapy, and we spend a lot of time in our fight and flight nervous system, where we're always on the go, and people underestimate how much stress they put their bodies under. So even something as being late going to work or being stuck in traffic keeps us in that stressed nervous system. And if you have any other conditions along with that, so it could be something like long COVID, or you've got fibromyalgia, or you've had an injury in your neck, those symptoms can be amplified. So the first part of massage is just taking that time to reset that nervous system. Turn down that trigger where everything is heightened, everything is stressed, and take a moment to bring that nervous system down and bring it calm. So part of the treatment that we do is calming the body. So there's a lot of nice parts of the massage. There's a bit of a stigma that in order for a massage to work, it has to be firm and it has to be hard. That's not always the case. We work with everyone's body in each individual case. There's types of technique called myofascial release, which works with the fascia and the connective tissue, which is where we hold a lot of pain, it's where we hold a lot of trauma, and especially if our nervous system's dialed up to 100, a lot of the tension is going to be in the fascia.
That's a great answer. I couldn't have said it better myself.
The
Even
answer
though
is
I
always
know
fascia.
it. Yeah, the answer is always fascia. Exactly.
And then we have the muscles. So depending on the assessment that we have with the person and the individual, there might be tension in the muscles, and massage can manually release the tension in the muscles. We work with trigger points. I mean, everyone in this clinic knows what trigger points is, and if you come along, we can educate you.
I think people
on different
trigger
ways.
points I always think is when clients come in and say I've got knots in my shoulders.
Yes,
I've
got a knot right there.
That's trigger points.
Yeah. So they're like little palpable areas in the muscles that as we massage, we reduce the tension in there, which the aim is to increase the range of motion and reduce the pain.
Yeah.
So we've got the aspects of the touch, calming down the nervous system. We've got the release of fascia, which can become tight and restricted over time for many different reasons. And then the release of any muscular tension. And then as a clinical setting, as a clinical package, we then look at how that person can look after themselves afterwards. So the care doesn't just happen just in this space.
Not for 1 hour.
Not for 1 hour. We have work that you have to work on yourself with when you go and continue with that, whether that's rehab, whether that's breathing exercises, whether it's a referral to another service. So it's looking at someone as a person, as a package, and that's what clinical massage looks at differently to maybe just a relaxing massage that you have, as relaxing as it can be.
It's bringing both in, isn't it, in that respect, and it's looking at the whole, and as you said, some people come in and they might need just complete de-stress, and other people come in and they've got particular pain and they want that working on, so you sort of treat what needs to be treated. But that's a really good answer. I love it.
And everyone's different. Everyone's different, and the same as the people that I work with in the hospitals and the care home. Everyone is different, so the assessment will be made for each person. So whether it's pain or relaxation that we're looking at, or managing symptoms, I mean, that's something that we work with each person individually.
And our training gives us that kind of ability to ask all those questions and then take out and decide what's the best treatment plan for that particular person. And we do tailor it in that way. So it isn't just the same formulaic thing each time. That's a brilliant answer. I suppose the last thing I'll touch on really is where you're going into the future, because I do understand that you're writing a book as well as finishing off your qualifications and working here. So give us a little bit of information about that.
So my particular interest, as you know, is with complex medical conditions. And as I was saying earlier on, there's a gap in the crossover between complementary therapies, which includes massage, meditation, reflexology, acupressure. That's what complementary therapy comes under, and the merge of it with the healthcare system. And so I'll be and my plan is to write a book to make it more accessible to therapists, to be able to integrate into the healthcare system
and get around all those accessibility issues, because it's not about just being able to lie on a couch. You can do a massage in any particular way.
Exactly. We can just sit here and have a wonderful shoulder massage.
I
know, anytime.
The camera's off.
And just looking at how we can work with the healthcare system. So one thing that I do at the clinic is if we're working on a particular rehab program with someone and we're working on getting the muscle stronger, I write to the doctors and they will take them to the appointments, and it helps move along their healthcare within the healthcare system. So it's something that is very straightforward if you understand the system. And
you've done
this
that.
clinic's really forward thinking with that.
And you've done that, haven't you? I believe with a few patients who were waiting for operations, and you've managed to bring them forward by writing to the consultants.
That's right. We've got a knee operation. Somebody's just finished their 8-month mark with their knee operation, and I've managed to get MRI scans for quite a few people because they have a rehab plan in place already. The doctor sees that there's a program in place already, and it's just another addition to the picture that is a person and
which
their
is
pain.
basically what highlights what we do above what, dare I say, a skin rub.
Wax on, wax off.
Yeah, exactly. Brilliant. Thanks, Kitty. That was lovely. Thank you.